Good day everyone. My name is Bajihana A. Canapia and today I'm gonna show you the transferring technique. So what is transferring technique? Transferring technique, it is use of proper body mechanics in repositioning, lifting, and transferring patients safely. What are the purpose of transferring technique? Transferring technique purpose is position and prepares client for variety of clinical procedure. The movement maintains and restore muscle tone. So, what are the equipment for the transferring mechanic? The first equipment is the bed. The second is the chair or wheelchair. The last equipment is the transfer belt. So for the first procedure, check the doctor's order and client diagnosis and restriction rationale to determine any contradiction or limitation to the client's physical activity. Second procedure, identify the client, inform the client about desired purposes and destination, rationale to reduce client's anxiety and increase cooperation. Hi ma'am, anong pangalan natin ma'am?
Karen po.
Ma'am Karen, lipat kita sa chair ha.
Opo.
The third procedure, assess the client ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instruction. Rationale to provide information about the client's physical abilities to ensure safe transferring. Kumusta naman yung lagay niyo, ma'am? Comfortable din kayo?
Opo.
Nagagalaw niyo yung kamay niyo, ma'am?
Opo.
Yung paa niyo po?
Opo.
Okay, ma'am. Then, the fourth procedure is obtain equipment needed and check its condition. Rationale to avoid accident while moving the patient. Then, next procedure is wash your hand to prevent transferring of microorganism. The rationale is wash your hand, rationale to prevent transferring microorganisms. When you finish wash your hand, adjust the height of the bed to the lowest possible position. Rationale to reduce distance that the client has to step down, thus reducing risk of injury. Next procedure, slowly raise the head of the bed if not contraindicated by client's condition. Rationale, minimize lifting, thereby minimizing discomfort for both client and healthcare provider. Next is place one arm under the client's leg and one arm behind the client's back. Slowly pivot the client so the client's legs are dangling over the edge of the bed. Rationale to support the client while sitting him or her on the edge of the bed. procedure, allow the client to dangle for 2 to 5 minutes. Allow the clients to dangle support the clients if necessary. Rationale, to allow time for assessing clients, response to seating, reduces possibility or orthostatic hypotension. Ma'am, hindi ka nahihilo, ma'am?
Hindi po.
Stay muna tayo for 2 to 5 minutes, ma'am, ha?
Okay po.
Next is, bring the chair or wheelchair close to the side of the bed. Place it a 45-degree angle of the bed. If the patient have a weaker side, place the wheelchair on the client's strong side. So the rationale is to allow the patient to bear weight on the strong leg. Ma'am, saan yung weaker side niyo, ma'am?
Dito po.
Dito?
Opo.
Next procedure is lock wheelchair brakes and elevate the foot pedals, rationale, to provide stability. Next procedure is putting the transfer belt on or other transfer aid if needed and secure. Rationale is provide safety and holds the patient without stressing joint or limbs. After that, lifters' knees are well flexed with back straight, hands gripping each side of transfer belt. The rationale is transfer belt is grasped at each side to provide movement. Rock the client's body to standing position in a count of 3 while strengthening the hips, legs, and keeping knees slightly flexed. The rationale is rocking motion give a client body movement and requires less muscular effort to lift the client. Ma'am, tayo in the count of 3, ha? Next is turn the client facing the wheelchair using pivot technique while maintaining the hold of the patient transfer belt. So the rationale is less effort for lifter and client. So the next procedure is instruct client to use arm to rest on chair. The rationale is to increase client's ability. Ma'am, lagyan natin yung kamay mo sa may chair, ma'am, sa likod po. Yan. The next is flex hips and knees while lowering clients into chair or wheelchair. The rationale is to prevent injury to client from poor body alignment. So when you're done in the procedure number 17, the next procedure is assess the client for proper alignment. For sitting position, support weak side with pillow if needed. The rationale is to make client comfortable. After that, secure safety belt, place client's feet on foot pedals and release brakes if you will be moving the clients immediately. If the client is sitting on the chair, offer a footstool if available. So the rationale is to ensure client safety. After that, wash your hands to reduce transmission of microorganisms. Next is record effect of the transfer to rationale to provide accurate data in the care of clients.